Welcome back to Living Local. March is Colorectal Cancer Awareness Month. It's an important time to spotlight this disease because in the U.S., it's the third leading cause of cancer-related deaths in men and the fourth for women. And joining us today to talk about some of the signs and symptoms of colon cancer, we have Dr. Ryan Perumpail and Dr. Samyuktha Ramavaram with Genesis Medical System, which is also this segment sponsor. Thank you both for being here and taking the time to come in and talk to us today.
Thank you for having us.
A very important topic. Let's start with what is colon cancer and who is typically affected by this diagnosis?
So colon cancer is an abnormal growth of cells in the large intestine that has the potential to invade other parts of the body and spread throughout. Traditionally, older people tended to be affected by colon cancer, but nowadays we've seen that there's been an increase in young patients developing this condition, particularly in those younger than 55. There's been a 1 to 2% increase in the incidence per year.
That's crazy to hear, and I'm sure that it just kind of blows your mind too to see so many younger people coming in. So let's talk about some of the signs and symptoms of colon cancer then.
So I would say that something that most people have to watch out for are change in bowel habits. If you have had any constipation, diarrhea, thin pencil-like stools, bleeding, any sort of rectal bleeding, even if you're in your 20s, 30s, it's better to get a colonoscopy done because most patients tend to attribute that to just hemorrhoids and kind of brush it off. And given that we have seen an increase in incidence of colon cancer in younger patients, if you're symptomatic, regardless of your age, get it checked out. Iron deficiency anemia on labs, any sort of unintentional weight loss, abdominal pain, just feeling tired. So it's better to get evaluated early on because colon cancer is preventable when detected early, and its survival rate is up to 90% after 5 years.
Okay, so talk to us, what age then should we start getting screened? And the importance, talk to us about the importance of patients being screened for colon and rectal cancers, because now that we're seeing a lot of younger people with this disease, what do you recommend?
So current guidelines recommend age 45 for average risk. So average risk in basically means that you do not have any family history of precancerous polyps or no family history of colon cancer. You do not have any personal history of colon cancer, no history of any inflammatory bowel disease, or any sort of hereditary conditions such as Lynch syndrome. So an average risk patient should start screening at age 45.
Okay, and so how much does family and genetics and all that play in to being diagnosed with colon cancer?
Yeah, those are both very important. Patients who have a genetic predisposition or have family members with either colon cancer or colon polyps may consider getting screened earlier and more frequently. That being said, the majority of colon cancers we find are among patients who have no family members, which highlights the importance of everyone getting screened.
Wow, wow. So let's talk about treatments. What kind of treatments are available then?
As far as treatment, for colon cancer itself, there's surgery, which is the mainstay, and patients who have more advanced disease, chemotherapy and radiation may be necessary. That being said, our goal is to provide colonoscopy early for colon cancer screening so that polyps can be removed and cancer doesn't form in the first place, so that advanced therapies like these aren't necessary.
Right, right. And we mentioned earlier that colorectal cancer, it's the third leading cause of cancer in men. Talk to us about those statistics and why more men are being diagnosed with this.
So now colon cancer is the #1 leading cause of cancer-related death in men younger than age 50.
Oh gosh.
There are no specific causes that they have noticed, but I think it's mainly the lifestyle that plays a big role. Certain risk factors tend to be consumption of red meat, processed meat, obesity is a big risk factor, alcohol consumption is a big factor, sedentary lifestyle. is a big risk factor. So I feel like in terms of statistics, 1 in 23 men get diagnosed with colon cancer, 1 in 25 females get diagnosed with colon cancer. But there are certainly modifiable risk factors that all of us can work on just to decrease the risk.
Lower that risk for sure. How much has technology kind of changed when it comes to helping patients at Genesis?
One of the great technologies that we have that's increasingly utilized is called endoscopic mucosal resection. It's the ability to remove large polyps that have a high risk of turning into colon cancer right during a colonoscopy. And during the procedure, we inject a special substance to lift the colon polyp off the wall of the colon and cut out the polyp in its entirety. Many patients can avoid surgery with this technique, and it's something that's been a great benefit to many these days.
Okay. Get screened early.
Absolutely.
That's the key.
That's the key, definitely. Doctors, thanks so much for coming in to talk to us today.
Appreciate it.
Thank you for having us.
Again, this segment was sponsored by Genesis Health System, and for more information, you can go to genesishealth.com/gastro. We'll also have all those details posted on ourquadcities.com.